So again, this is the second part of cardiovascular diseases. So to repeat, what are cardiovascular diseases? So cardiovascular diseases are basically the diseases of heart and blood vessels. So in the last clip we have learned about the coronary heart disease. Here in this part we will discuss the three other disorders related about the cardiovascular. One is heart failure, second is about the faulty heart valves, and the third one is about the extensive blood loss. So first of all we learn what is heart failure. We may have listened many times about heart attack, but heart failure, when heart completely loses its ability to function, means after heart failure the heart cannot do its work again. So the only solution for the heart failure, like the other organs like kidney failure, you have to replace the kidneys. Liver failure, the only solution is to transplant the liver. So same in case of heart failure, the only solution is the transplant of heart. So there are two possibilities. One is the heart transplant by artificial heart. So what is an artificial heart and when it is used? So basically artificial heart is used by the time there is no suitable donor heart is available to be transplanted. So artificial heart are mechanical devices which are made up of metals and plastics, but these mechanical devices pump blood around the body as like a normal heart. So it means these artificial devices, these artificial hearts can buy very valuable time for the patient in case by the time that patient doesn't get any donor heart from some other person. But there is another advantage of having a artificial heart being transplanted, that there are less chances of rejection. Why there are less chances of rejection? Because these artificial hearts are made up of metals and plastics, and as a result our body, the patient's body will not recognize these as foreign objects. So in case of artificial heart, so the benefit is that there is always a less chance of rejection. But there are some problems, and the second benefit is that it is a temporary fix and it can buy a very valuable time for the patient to stay alive. But there are some disadvantages of artificial heart as well. One, that these hearts may wear out, after few years they may have some problems. There may be a problem of motor failure, and secondly, the blood will not flow as smoothly through the artificial hearts as it will flow from a healthy normal heart. The second obviously possibility in case of heart transplant, that if the patient get a suitable donor, so then that person can have a heart transplanted from any donor. So but there is a disadvantage, that there are more chances of rejection, because the immunity system of the body may reject the foreign body. And the advantages are that the healthy normal heart from some other person, that biological heart will have a more smooth flow of blood through it. So this is an advantage. So this is all about heart failure very briefly. The second problem in cardiovascular disease is faulty heart valves. So valves are basically the doors between the different chambers of the hearts, and these valves, they prevent the backward flow of the blood. So faulty heart valves could be the result of infection, as a result of infection, as a result of heart attack, and also as a result of old age. So infection, heart attack, and as a result of old age, the patient can have faulty heart valves. So severely faulty heart valves need to be replaced because these valves cannot work their function properly, and they may leak. So as a result, the blood can flow in both directions, backward direction and forward direction. The replacement valves can be of two types. Biological means the surgeons get biological valves from the other living organisms, from the other mammals like cows and pigs. And there are mechanical mean man-made, made up of metals or of plastics. So these are mechanical. Although this surgery for the replacement of faulty heart valves is less drastic as compared to heart transplant surgery, but still that is one of the major heart surgery, and there is always a risk of blood clotting, blood loss, and there is another problem which is called blood loss, extensive blood loss, in case as a result of these surgeries during heart transplant or during the replacement of faulty heart valves, there may be lots of blood loss. In that case, the solution is, if the matching blood is not available, we call it artificial blood. Like artificial heart, there is also artificial blood. So what is artificial blood? Artificial blood is a salty solution, saline solution, but there should be no air bubbles inside, otherwise that is very risky. So salt solution with no bubbles, air bubbles inside, and that is called artificial blood, and that is used to increase the lost volume of the blood inside the body. So in case 2/3 red blood cells are lost as a result of blood loss, so even then, if the volume of the blood is replaced by artificial blood, the patient can stay alive, and its circulatory system can work as normal, and the patient can reproduce its lost red blood cells. So for that time, the artificial blood can be used to increase the volume of blood for normal circulation of blood. So this is all for the disorders or the problems related with our topic of cardiovascular diseases. So again, the 4 areas: coronary heart disease we discussed in the previous clip, and then heart failure, faulty heart valves, and then extensive blood loss. Thank you very much. See you in the next clip. with some other topics of biology.